Hello guys, welcome back to my YouTube channel. It's your girl Aborita Ogechuku, a medical laboratory technician by profession. I would like to wish you all Merry Christmas and a prosperous New Year. So today's topic is hepatitis, causes, treatment, and prevention of hepatitis. Then, what is this hepatitis? Hepatitis is an inflammation of the liver, which is caused by a viral infection. And there are other causes of this hepatitis apart from virus. We have autoimmune hepatitis, which results when the body produces antibodies against its own liver tissue. In this condition, it can cause inflammation of the liver. Then we have some medication toxins. When you inhale some toxins, drugs, and excess intake of alcohol can cause this inflammation of the liver. Then we have about 5 main classification of hepatitis. We have hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. And there are different viruses that is responsible for each of these hepatitis. Then I'm going to take these hepatitis one after the other. Hepatitis A. It is caused by hepatitis A virus. And one can contact this disease or this infection by eating undercooked seafood. It's in a situation whereby water is contaminated with hepatitis A virus, and there is a huge possibilities that some sea animals can contact this hepatitis A virus. And a situation whereby these seafood or sea animals are hunted for consumption. So when it is not well cooked, there is a possibility that this virus can still be there. And when you eat it, you can easily get contaminated with this hepatitis A virus. So eating undercooked seafood can cause this, and coming in contact with a person who have this hepatitis A virus using common items together can also cause this hepatitis A virus. That is, using a common items from a person who have this hepatitis A. From this, you can contact it. Hepatitis A is a short-term disease which usually go away after some weeks or a month of contacting it. Then we have hepatitis B virus. Hepatitis B virus, one can contact it by coming in contact with body fluid of an infected person. Body fluid such as blood, semen, or vaginal secretion. One can also contact it through sexual intercourse. It is usually a long-term disease. That's it. It lasts for Oh my god, it's a chronic disease. It lasts longer. It's not like hepatitis A that can come and go, but this one can come and stay and inhabiting your liver and deteriorating them, damaging them, especially when it is not detected on time. So another virus is hepatitis C virus. Hepatitis C virus causes hepatitis C. One can also come in contact with a body fluid, especially blood. It is a blood-borne disease whereby one come in contact with the blood of a person who has this or who is infected with this hepatitis C. It is also a chronic disease, that is a long-term disease that can last for a long time. It doesn't just go away. You have to take medication, antiviral medication, for it to be managed or for it to be cured, depending how severe it is. Then we have hepatitis D virus. This hepatitis D virus is a rare hepatitis. It is a rare hepatitis that usually manifests or that usually occur in persons who have a pre-existing hepatitis B virus. It can also be transmitted by blood of an infected person. Then we have hepatitis E virus. It's a waterborne disease that results from exposure to hepatitis E virus. It is mainly found in an area with a poor sanitation, and one can be contaminated by ingesting fecal matter that is contaminated with water, that is drinking water that is contaminated with fecal matter. Through this, you can contact hepatitis E, though it is a short-term disease. That's an acute disease that can usually go away after weeks or a month of contacting it. Then, but in a pregnant woman, it is usually very dangerous when a pregnant woman contacts this hepatitis E. It is usually dangerous, so there is need for an urgent care to be taken. Then treatment. It's like I said, it sometimes doesn't require treatment. It just come and go. Unlike hepatitis B, hepatitis C, hepatitis D, this hepatitis requires treatment with an antiviral medication. Then we have then general symptom of this hepatitis. We have number one, fatigue. You'll be so tired, so weak. Then another one is you have dark urine. When you urinate, your urine will be so dark. Then pale stool. Another one is unexplained loss of weight. You'll be losing excess weight. Then we have loss of appetite. You don't feel like eating. Then we have skin and eye yellowness, which is commonly known as jaundice. So these are common known symptoms of hepatitis A, B, C, D, and E. Then coming to the diagnosis, how it can be diagnosed. When you notice all these symptoms, there is need to see a physician. So first of all, there will be a physical examination, checking your eyes, the skin color, in case if there is yellowness of the skin and the eyes. Then checking your abdomen to check for pains, because there is usually abdominal pain for anyone who have this hepatitis. The another diagnosis is undergoing liver function test. So this liver function test is a test that is done to check the level of your liver enzymes. For in a situation whereby your liver enzymes, the liver enzymes is high, that is, so in a situation whereby there is too much of these liver enzymes in the blood, it's showing that there is maybe the liver is stressed, damaged, or it's not functioning well. So after that, they can go for ultrasound, that is to have a picture of your liver. Then we have antibody and antigen reaction test that is being done with blood sample. So how can this be prevented? By undergoing or taking vaccine, going for vaccination, being vaccinated. That is one way to prevent this and hepatitis. Then another one is reducing the exposure or causes of this hepatitis. When cooking, ensure that you cook all your food properly, especially your seafood, that is sea animals, and then keeping your surrounding clean. So that is all about hepatitis. So that is what I have for today. So please, if you are coming across my video for the fourth time, I am pleading that you subscribe to support me. Then if you like what I'm doing, please, I also pleading that you like and share my video. Then in the comment section, if you have any question or you want to ask me something, the comment section is open for you to ask question or to comment on the video, or to even raise a topic that you would want me to treat. So that is all. Thank you for watching. Enjoy your season of Christmas, and I'm wishing you a prosperous new year. Take good care of yourself. Bye.
Subscribe, share and like.